Obviously, people have the right to remain anonymous if they want to, but where direct communication needs to happen, it then does. And then obviously step 5 is kind of the reporting and analytics. Exploring the technology was actually really hard of what could do this in a field-based setting. Unfortunately, a lot of the technology available is also doesn't pass Oxfam's quite tight data protection standards, especially when we're thinking of collecting personal identifiable information. Originally, we did use Comcare for the pilot, but for various reasons, which I'll go into later, we've actually switched to use Survey CTO to do this process. In terms of the implementation, what we found is we actually spend a whole day addressing training on accountability. So obviously if teams have recently undergone accountability training, then this is vastly reduced. But what we found is that we really need to try and build the culture of accountability. So looking at training key staff on kind of Oxfam's definition, we have 5 dimensions of accountability, exploring the core humanitarian standards, and thinking about power dynamics between the person giving the feedback and the one that's listening, and how changes in power or imbalances in power need to be taken into consideration, as well as training on responsible data. So Oxfam has a responsible data policy, and we've just released some training materials, and this is kind of there's no hard and fast rule, unfortunately, but just building the understanding that we as Oxfam, we are collecting a lot of data, and we need to be both legally adherent but also morally and ethically looking after that data so that we don't do any harm. Obviously, part of this is thinking about what are the current feedback mechanisms. This system is not one system that can take over all types of feedback. There still needs to be multiple systems in place. So it's looking at how this system fits. Can it replace anything? But we're still always going to have a hotline. Suggestion boxes are also good one to have, and it's about having a multitude of ways that people can give feedback to make the various mechanisms as inclusive as possible. We also need to think about who's actually currently responsible for reviewing and responding to feedback, and how do people actually currently responding, and potentially how this system could change that. Now in Za'atari, they had a multitude of feedback mechanisms, but actually responding to the feedback was a real challenge, and we found that they're so stretched in terms of their resources that it was often put to the bottom of the list. So it was trying to explain to staff that this still needs to be done. However, hopefully this system will help you do it more efficiently and more easily, but the job still needs to be done. One of the exciting things about this mechanism is thinking about referrals. So how are referrals currently managed? It seems to be different in a lot of contexts, but what we've tried in one location, which wasn't this pilot, but what we've done since, is actually we have a partner organization that is using the same system, and they actually have their own case list. So it's one feedback mechanism, and we can automatically refer feedback between different agencies. So the partner has their own case list, and they can either ping it to Oxfam if they need to, or Oxfam can ping it to them for follow-up. And then thinking about how internal reporting for feedback is handled, what current systems are in place with the MEAL teams or the MEL teams, and how this system might change that. The great thing is we can look at longitudinal reporting, from when a piece of feedback has come in, how long is it taking us actually to respond and get back to people. So an example of how the case lists work. So when we're in country, we look at how we can, the design of this, because we are trying to come up with some hopefully common categorizations, but at the minute we're just at the piloting stage, so we need to continue to learn before we could put anything standardized in place, because the most important thing is this add values to country staff. But obviously the feedback comes in. If it's resolved, it goes straight to the meal team for reporting. If it's referred, it can be referred to any of these teams. So we've got meal, public health promotion, public health engineering, solid waste management and cash for work, livelihood and recycling. So this was actually the first categorization we came up in Za'atari. So when it's referred, as I said, the case lists are kind of private to each team to deal with, but meal have access to all the back-end data, so can keep tabs on perhaps what might be slipping through the net and speak to those people accordingly. But this is done in country, designed with the teams as to what is the best categorization for them based on the way that their teams are set out, which can vary so wildly. Then we split into kind of sub teams. So we have subcategories. So actually on the left is how it looks on Comcare. So when you're actually collecting the feedback, it's just an open text box. So you literally are typing in not everything that someone's saying, because we don't need an essay, but keeping it as succinct whilst not kind of changing the tone or the way that it's being said. So that's an open text box, and then it's obviously just single choice back into kind of standard mobile survey type thing, single choice question for the category, the team responsible, and then the following question would be what subcategories are associated. So these were just some examples from Za'atari, and again that's just done with the teams creating their own of what would be most helpful for them in terms of their categorization. So in terms of learning to date, we have had some successes and of course some challenges. And one thing that was really interesting with the evaluation was the fact that trust. We found that there was an increase in trust between the community mobilizers and the community. Now in Za'atari that was a real win because trust is relatively poor, because nobody imagined that Za'atari would still be there today and so large. But we found actually as part of that, which was both a blessing and a curse, we had huge increases in the amount of feedback received, which obviously created its challenges because we needed to be able to respond and deal with that increase in feedback. And we think part of that is the link between people trusted that actually if they told us something, we would do something about it. And what we could demonstrate was we had a really fast feedback process. So in terms of at the point of collection and the actual response, it was about a week on average. So we would respond back to that individual within a week's time. In terms of the classifications, there was allowed, multiple feedback classifications, and we ensured that it was dynamic and flexible. So as new program kind of updates or changes take place, we could ensure that the technology could be adapted to include those new categories potentially, or even new teams that then might need to deal with their own feedback. And what we found with it is scalable. What we now have is scalable, which in terms of the challenges, so I've split these into two. So one is actually the pilot specific to Za'atari and the kind of bigger picture challenges. But Za'atari specific, it was such a short time frame. I think we've really learned that Oxfam can't be hugely innovative within a 6-month time frame. It's really challenging. It was also so small that any learnings that we had, how can we really take that forward? Finding the right tool was a challenge. As I said, we started with Comcare and actually switched. Oxfam won't host data in the US, and unfortunately a lot of the technology providers do host data in the US, so we needed to look for one that could host data in the EU, which severely limited our choices, as well as provided an issue in terms of using Comcare, as well as kind of the amount of money that some of the technology was costing. I think mobile case management tools are often designed for you know, big companies, and perhaps the NGO space isn't quite delving into it yet. But the great thing is, using Survey CTO, it's $200 a month for unlimited use. So that's really kept costs down for us. IS support, this was in country, so having an IS being, sorry, IT, we call them information systems, but I know they're called information technology teams more widely. So actually having the local ITIS support really being engaged and part of this, we didn't engage them in the right way, but also the capacity that they actually have to support would have been a challenge. We had huge high staff turnover, which is always a problem, but unfortunately was particularly unlucky for this pilot. The PM was in his last week when we arrived, and the deputy PM left, and the meal coordinator left, and then we had a whole new team come in about 3 months later. So it was really challenging just to keep the consistency. And of course, as always, limited resources, mainly from a staffing perspective. And perhaps looking back, we would have ensured that perhaps there were more or someone on the ground permanently, or at least part-time, to really focus on this. In terms of the bigger picture, you know, really looking at what data and why. What do we need at local level, at potentially a larger level, but also why do we need it, and actually what are we going to do with it? Because if we're collecting data, we can use that data to really inform our programming, and often that's what gets missed. Responsible data, as I mentioned, trying to build capacity and knowledge in terms of how we can look after the data that people are giving us, and really be both moral and ethical, as well as adhering to legal standards, which in itself is a challenge. Inclusivity came up, and in particularly in relation to the pilot. Now, obviously, every feedback mechanism that we use has limitations in terms of inclusivity, and technology immediately creates issues with inclusivity. But when this was responding face-to-face, what we didn't realize, and perhaps it was amplified in Za'atari, was that as soon as that technology was in a person's hand, that person is immediately biased, and some members of the community then wouldn't feel able to go and speak to the person. So looking at how we can tackle that in terms of proactively going to protection case lists or something to get feedback would be something we need to explore. As I've already mentioned, accountability culture, I think because our meal officers have an A in their name, people think accountability is all down to that person, and actually it's about shifting the responsibility more widely in the program team. So that's something we're looking at. And then the coordination and referrals, and in particularly the external referrals, because I think that's quite an exciting part of this project. I'm whizzing through. So in terms of the next steps, beyond Za'atari, we have Greece and Iraq currently using the system, and we've recently received scale-up funding to try this out in 5 countries across the Middle East and in Ethiopia within humanitarian context. So we about to embark on this 2-year multi-country program starting the beginning of July, so we can really begin to test some of these and actually do a lot of the strategic thinking around the analytics, the inclusivity and the accountability culture, and try and build that up. And as part of this, we're creating a kind of data hub, which will be where we, no matter how data is collected, whether it's an Excel spreadsheet or whether using this system or other mobile data collection systems, we can push it into a central kind of repository to store our program data and then pull that through into reporting, so we can actually begin to look at things like national level reporting, or even, if it was even remotely valuable, which is questionable, global reporting. But particularly on the national scale, we think that will be very interesting. So that's it. If you wanted to hear more about the pilot specifically, I've put the link at the end of this presentation.
Yes, I work for Transparency International Kenya. In the Department of Humanitarian Aid Integrity Program, a program that we started way back in 2014. Mohammed, you're seeing it now?
Yes, go ahead please. Yes.
Thank you. Yes, this is a program that we started way back in 2014, preceding a study that we did in Kenya, and basing it in northern part of Kenya, where we are facing frequent drought situations. And so many agencies, including the government agencies, are really responding to this drought. And this study brought about two key major findings, that the communities that were affected by this drought were not involved or included during selection of beneficiaries who are to benefit from this response. And at the same time, if they had any complaints or they had any feedback regarding the response that these agencies were giving, they were not given any avenue to send in their complaints or their feedback regarding the response. So Transparency International Kenya, out of the study, came up with one program or project that we call Social Accountability, that is looking at creating awareness among the community members. And we're doing it in 4 counties, that is in Turkana, West Pokot in Kenya, Wajir in Kenya as well, and Marsabit. So this one is purely on social accountability. But now Wajibikaji Pamoja, which is loosely translated to accountability together, came in after the social accountability. And this is focusing on feedback response and complaints response, coordination of the response or feedback from the communities. So essentially, this is a Kiswahili word, and it is focusing on automated. It's an automated web-based integrated complaint referral mechanism. And it's being implemented in Kenya together by TI Kenya, Transparency International Kenya, together with 71 partners within the 4 counties that I mentioned. We have 20 partners in Turkana, 22 in West Pokot, 18 in Wajir, and Marsabit 11. And Wajir essentially is one of our counties that we are looking at from another perspective, because they've integrated the complaint system into the structures of the county government. And the program is focusing on improvement of quality of services by these service providers. And the service providers in our context in Kenya, we look at this both state and non-state actors, which is the government and non-governmental organizations, both international, the local ones, and even the CBOs within the counties. How the system is being implemented here in Kenya. Sorry, Farah? Farah?
Yes.
You getting me?
Yes.
Yes. So we're looking at this system, and we have seen the value that is adding. That is the value add for this Wajibikaji Pamoja. Don't go down. Yes. The value addition that has brought in terms of our service here in Kenya, both state and non-state actors. And we're looking at the service or the project promoting sustainability and reducing redundancy by placing community destiny in the hands of the city. The community is given the core mandate to monitor what is happening in the communities in terms of services offered by this state and non-state actors. At the same time, it's a collaborative kind of a program or a project where it's not confrontational per se, but it's advocacy rapport, where state and non-state actors come together with the community, and the community are given that opportunity question or give feedback on this system. So in other words, it's creation of rapport between the community and the service providers in that community, meaning so ownership among the community, participation within the community is enhanced at the same time by this through this project. Again, by improving their performance, Wajibikaji Pamoja has helped to service providers to be effective in discharging their duties. In other words, this is where the service providers become credible enough. Every other time they serve in the community, they are aware that the community know their rights, and they're able to send any feedback through the system so that people can follow it up. I mean, like Transparency International, any government agency that is following on the services that are being offered in the community. It's a one-stop shop again for us, because and for the agencies that are serving in the community, they can access what is required of them in terms of accountability at any time and any given period, so long as you are in a place where there is network. At the same time, coordination among service providers at the county level, information is being provided. And because the project is focusing on information sharing between the service providers and the community, so coordination becomes easier within the locality where the project is being implemented. It has also established linkages within the counties the community and the authorities as well, and not authorities for the county government alone, but also the national government, because the county government, we have the county assembly who are like oversight authority in the within the counties, and within the counties as well, we have the national government representative, the county commissioner. So this linkage together with the community has brought about you're not doing something when someone else is not seeing. So you do things in synergy, and as well you don't replicate one another, but you like share ideas, and then when one has done this, the other one has done the other one, so there is no replication at the end of the day. So meaning that linkage and that coordination becomes something that has enhanced service delivery in the community within the areas that we are serving in Kenya. As well, the Wajibikaji Pamoja strengthened linkages with the law enforcement authorities like oversight institutions. I've mentioned the county assembly, I've mentioned the county commissioner's office within the local, the county level. I've also mentioned the community having linkages with these authorities, so that when there's something they want to, concerning service delivery, they're always ready to share, and they're always ready to seek feedback from these authorities. Relationship as well has been enhanced because the service provider together with the people who are consuming the service, that is the community, the relation has been that mutual kind of relation. There's a lot of trust because through Wajibikaji Pamoja, if you go down to the community, you share the project, you as well have that relation building, and trust has been enhanced. So there is no one who is like questioning. When you bring a project, you involve the community. Through Wajibikaji, people have known that they are supposed to be involved, they are supposed to be included. And so that relation has really grown in the 4 counties, and what we get, public participation is really enhanced within those communities. Again, it's a platform where Wajibikaji Pamoja platform is implemented, participation of the communities in development and projects, and more willingness for service providers to listen to the community concerns as well. It has really grown because before the Wajibikaji Pamoja program, any contractor was contracted by either county government or national government, there is no information that could sift through to go to the community. They would only say we are sent to do ABCD, and you would not know how much money has been put or how much resources has been put in that program. In other words, through this program or the platform, we've also seen that there is a lot of willingness now between the service providers and between the community, and they share a lot of information concerning services they offer in the community, which is a great concern. I mean, which has been great for us. It's a success. It's a total success. This is the value addition that we have for this program. In terms of how because it's a web-based platform where we get a lot of complaints from the community. In terms of how these complaints are resolved, all complaints are fed in the web-based system. And every county has unique code where the community send feedback direct, and there are no charges. So the service provider, the network service provider, which is Safaricom in Kenya, we paid for it, and after paying for it, the people are given that mandate. They send their complaints using the unique code. For instance, if you're in Turkana, you have your own, Turkana has its unique code, and in West Pokot has its unique code. Any other county has a very unique code. In other words, no one, it cannot conflict, because any feedback from West Pokot just focuses on issues that relate to West Pokot or service provision related in West Pokot. So the complaints are fed into the system to the organizations concerned, and then after feeding into the system, a convener who is sitting at the county government level is charged with the responsibility of now referring or sending the complaint to the specific organization. That specific organization is supposed to give feedback within 7 working days after the referral has been done. Then the complaints receive a tracking number via the SMS that the complainant has sent the complaint. So when you send in a complaint, you get a tracking number where you get to know or to find out how the complaint has been worked on, addressed by this concerned agency or institution or the county government or any other agency who is subscribed to this website. At the same time, if no action is taken or response is given after the 7-day period, the concerned organization will receive a reminder by email, and this is from our convener now through the system again, who will then be notified to follow it up. Go down, Farah. Yes, thank you. And then, yes, the system also generates data and reports. That is the beauty of it, because at the end of every month during our coordination meetings, because we bring our partners in the county level to our meeting, every month. So during the coordination meeting, report is generated through the system as well, where the partners go through it and they get the data, how many complaints has been received, how many complaints has been addressed, and how many are pending. And these reports are regarding the type of complaints received by geographical area, that is now the county level that we have, and per sector as well. Which sector? Is it education sector? Is it agriculture sector? And also gives by the age group. How many within the age of 20 to 30 people, how many send in complaints? Within above 40 years, how many send in the complaints? And at the same time, the gender, how many male, how many female? The system is able to give that report as well. So in other words, it's easier to track which reports come from which area, which age group, and from which gender of the human being. And then that's informing the policy makers and decision makers the trends at the county level. For instance, if a complaint relates to a sector, education sector, and so many complaints relate to education sector, the education sector will as well have that opportunity to review and refine their programs that target the community. In other words, it's a tool that as well, it informs the programs the county government and other agencies are doing in a given area. If an issue or so many means any organization that does water, they will know which area specifically to target and on which sector in the water sector, which specifics they are supposed to target so that they can inform or address the issues affecting the community. So it's as well a planning tool. It's as well helping, the platform is helping to plan really affects or relate to the needs of the community. Lastly, the value addition. Okay, all complaints are then confidential and feedback is provided within 7 days. That is what I've said. So this system is confidential, and we've looked at it in terms of safety, we've looked at it in terms of confidentiality and the effectiveness. So in terms of safety, this is because either you use SMS, you either use online system if you have web, but in our country here in Kenya, the areas that we work, there are no website, there are no network coverage, but there's a lot of network in terms of the telecommunication now, the mobile phones. And so many complaints we receive are come through the SMS, the toll-free SMS that we have in different counties. So we've seen it's safe because if you have your phone and there's something that affects the community relating to service delivery that is given in that community, you just go back to your phone and write that complaint and send to the system. And from the system now, convener does the referral, follows it with the relevant authority or relevant agency or institution until a feedback is given within 7 days. On the lessons learned, we've had goodwill of partners and really has made the platform so successful in terms of promoting transparency and accountability in service delivery in the 4 areas that I've mentioned in Kenya. And then resolution of complaints as well, community sensitization and community outages. It has really been made so easier because of partners implementing in the counties. They've had that buy-in. So everybody is really rushing to move together with us in making sure that any issues relating to the services they offer in the community are addressed promptly so that they can move on and do the implementation of the initiatives within that community. Number 2, another lesson learned which is very important as well, the approach employed in sensitizing the communities on Wajibikaji Pamoja has made it possible for ownership by these communities. So there is a lot of ownership because immediately we did a launch in the 4 counties, there has been a lot of overwhelming feedback from the community in terms of complaints. So ownership by the community, and they know that this is only the platform that gives them the mandate to complain on services that they receive in the community. And at the same time, it's a platform for them which is safer, which is confidential, and which is effective because there is no one who can victimize them because they don't know who are sending the complaint. We always conceal the identity of the person who sent the complaint because we value the safety and confidentiality of that person. So the buy-in by the community has been very tremendous. Another lesson that we've learned, the county governments are beginning to appreciate the platform, which is very key, and I talked about Marsabit County, when we are using it to market the other counties, to market to the other counties, to entrench the system or the platform into the county structures. Because Marsabit County government has already have a convener or staff who is managing or coordinating the Wajibikaji Pamoja platform in the county. So we as TI, we are only bringing in the technical bit and training the staff on how to use the system, and even to follow on the complaints within the community, and more or less to also create awareness among the community. But the county government has put a staff who is charged with that responsibility of following up issues and making sure that the feedback from the community is addressed, not only by which is related to the county government alone, but also the other agencies working within that Marsabit County, so which is a plus for us. So they've done the entrenchment, and that is a lesson that we've seen. And so many counties are now coming in. They're asking us to go to the counties, and the only bit that we are seeing as a big challenge is the resources for us to set the platform in those counties, and also to have the specific codes for the counties, because the buying has not gone beyond for them paying some money for us to create the toll-free SMS for them, and to create a web platform for them specific for that specific county. But we've had a lot of advocacy, we've had a lot of lobbying, and we hope when we get more funds, we will go to as many counties as possible in Kenya, not only in the northern part of Kenya, but also in every part of this country.
So you have 2 more minutes.
Yes, 2 more minutes. I'm just summarizing on the system. It's being implemented. I've talked about so much steering committee within every county, which is selected by the and manage the convener and the system at the county level. And then the convener is sorted at the county office. I've talked about that, Marsabit. And then joint information and communication campaigns at the county level by the partner agencies, public meetings and direct engagement with the citizen at grassroots level. Then moving forward, in the next few months that we have some resources, we want to influence the anchoring of this platform. As I said, according to our constitution, we're specifically establishing modalities and platforms for citizen participation and sustainability. We want to influence the anchoring in the other 3 counties, and then also support the county government to engage and address feedback complaints from the citizens. And lastly, we also want to have linkages with oversight institutions like the Ombudsman Office, that is in Kenya, Office of the Administrative Justice, the Kenya National Commission on Human Rights, and then also the Ethics and Anti-Corruption Commission at the regional and national level. That is where we are in terms of wajibikaji pamoja in Kenya.